While most of us are seeing case numbers and graphs, some Canadians are living them.
This is very hard for me to do. But you know, you never think this virus will come to your house.
Edna Nabis tested positive in October following a wedding. She made that video here in tiny, remote Little Grand Rapids. While the first wave of this virus spared Manitoba's First Nations, a recent spike in cases has been devastating.
I know a lot of people thought that we were immune to this, that it wasn't going to come here, you know, until the second wave came.
The breathing and all that's tough, but the isolation is really tough.
Dr. Richard Doran spoke to us from his bed inside an intensive care unit. His wife, Jennifer, is also a nurse.
He has pneumonia. He also has the ground glass appearance in his lungs that COVID typically induces.
They don't know who or where he came in contact with the virus. But in Canada, healthcare workers represent almost 1 in every 5 cases of COVID-19. Dr. Doran is recovering, but says things could have gone differently.
I've treated COVID patients, so I'm getting the perspective from both sides. And I mean, you see people who get no symptoms, and yet I've seen people die.
My dad passed away.
No group has suffered more neglect and death during this pandemic than seniors living in long-term care.
If an airplane crashes with 40 patients on or 40 people on, it's a disaster. If a boat sinks, it's a disaster. Well, what do you come 40 people dying in a nursing home?
Larry Bailey lost his father just weeks ago. Glenn Alvin Bailey was in his 80s and full of life.
Hi kids, how you doing?
Always with a smile. Bailey says his dad touched so many lives through his years of community service.
Thank you.
The flowers haven't stopped coming. Bailey says people living in long-term care need better protections.
I feel so guilty that I got talked into keeping him there.
Unlike others, there was a goodbye.
I wouldn't leave unless he told me he loved me.
He did. Yet another moment he'll never forget. Christine Birak, CBC News, Toronto.
Well, a sobering reminder of the toll of COVID, and doctors, a last word from both of you. Dr. Hoda, you said maybe we should have some good news sometime, some cause for optimism. So here's a challenge for you. Where can that come from?
Well, I think thinking towards a vaccine is definitely something that's a nice beacon of hope for all of us. But also we're entering into the holiday season, and it's a time for giving and generosity and hope. So, you know, I like to think of this as an opportunity for people to think about how we can support each other in our communities during this really difficult time so we can get through it a little bit more easily.
And Dr. Bogosh, we have about a minute. What should Canadians be thinking about tonight, this weekend, in light of these rising COVID numbers?
I think there are certainly things that are under our control. There's lots of things that are not, but there are things that are under our control. We can do our best to keep ourselves safe, our family safe, our community safe. And really, truly, vaccines are on the horizon. And with the snippets of data that we have available to us, they look like they're really, really good. I know we're not supposed to say it. We're not supposed to say they're a silver bullet. They might be a silver bullet. Like, they really might be an extremely helpful tool that helps us get out of this pandemic. And I think the very beginning of 2021 might not look so good, but as we move through 2021, I think things are going to just get better and better and better and better.
Really nice note to end this portion of the program on, and I really appreciate you guys taking the time late on a Friday night. Dr. Hoda and Dr. Bogosh, thank you very much.
My pleasure.
Thank you.